Carnitine. Is it a powerful fat loss agent, or is it simply slowly but surely and silently increasing your risk for heart disease?
This is my dream, time to manifest it. Hey. I've been starving on my demons, slay like anorexic. Why you present? Stop with all the questions, time I teach a lesson.
What is up, team? This is Quinn Stilson with the Quinn Coaching. Today, talking all about that controversial supplement, Carnitine. It's used for its proposed benefits of improving fat loss and potentially even improving patient outcomes after heart attacks or improving patient outcomes for those patients with heart failure. However, underlying all of these proposed benefits is also some proposed safety risks and some serious safety risks at that, meaning mostly its ability to increase atherosclerosis or that stenosis of the vessels that can lead to heart attack and strokes down the road. We're going to talk about all of these benefits, risks in today's episode, and to start with that, we need to talk about where you can even get carnitine. So carnitine, obviously, you can get it through powder, through supplementation, which is probably why most of you are looking at this video, but you can also find it in your diet. It's really found mostly in meat and dairy products, specifically red meat. And that's going to be important when we talk about some safety concerns later. But carnitine is at its highest concentration in red meat, such as steak, in which has 100 milligrams of carnitine for every 5 ounces. Whereas for supplementation, you're going to be seeing about 1 to 4 grams of carnitine taken per dose. So you're not going to get as much with the red meat, but you are getting a significant amount. Versus with milk, you're only getting about 8 milligrams a cup. Asparagus, peanut butter, avocado, or some more plant-based sources of carnitine, you're even getting smaller amounts. So really the only true dietary source that you're actually going to see significant amounts in is that red meat. And again, that'll be important later. So once we've taken carnitine, either by supplementation or really by red meat, what is it going to do? What is its actual scientific mechanism as far as how it could arrive at these proposed benefits we just mentioned? Well, the primary mechanism of carnitine is that it shuttles fatty acids through the mitochondrial membrane so they can then be used for energy or as a fuel source. Now, you can imagine why this is so beneficial, or at least why mechanistically it could be so beneficial, because we're essentially able to better take in fatty acids to be used as energy instead of allowing them to be stored as body fat. Now, that's the primary reason as to why, or the primary mechanism as to why carnitine could actually improve fat loss. However, there are some secondary mechanisms that could also promote this effect, such as one, carnitine has been mechanistically demonstrated to improve insulin sensitivity, and also it has been shown to actually decrease appetite through directly acting on the brain at a specific location known as the hypothalamus. Another possible benefit of carnitine is its ability to decrease muscle soreness and improve muscle recovery. It does this mechanistically by limiting protein breakdown, really regulating protein synthesis or building protein through building blocks of amino acids, regulating that with how much protein we're going to catabolize in order to get energy. And it also has this effect of decreasing muscle breakdown by being an anti-inflammatory, being an antioxidant. Those are kind of the main mechanisms of how carnitine could work. However, in order to actually see these mechanistic benefits, you actually have to increase the carnitine concentrations in the muscle. And I probably sound like a broken record at this point because this is very similar to creatine or to beta-alanine, in which it's not about supplementing these supplements right before you work out. This is not a pre-workout supplement. It's a dietary supplement that you take chronically in order to increase the saturation of the muscle. And then once you have actually increased that concentration, then you can actually see the benefit of carnitine or creatine or beta-alanine in the other videos. Now, how long does it actually take to increase carnitine concentrations within the skeletal muscle? Well, studies have shown very little benefit of carnitine supplementation when that supplementation is less than 2 months. So really, and most of them have shown even greater than 3 months is required. So you really need to be supplementing with carnitine for either 2 to 3 or more months in order to actually increase the concentration of carnitine within the skeletal muscle, which will then allow you to see those metabolic benefits of improving your fat utilization for fuel and improving those anti-inflammatory properties, decreasing the muscle breakdown, etc. Now, you also benefit greatly by taking carnitine with carbohydrates. Now, why is that the case? Well, you actually need insulin in order to actively transport carnitine from the bloodstream into the muscle cells. That's because there's a higher concentration of carnitine naturally within the muscle than there is in the bloodstream. So it's not going to naturally flow from where there's a low concentration of it to a high concentration. Instead, it needs to be actively transported, and it does that through insulin, or at least it's insulin mediated, meaning if you take carbohydrates with carnitine, you're going to increase your insulin when you take those carbohydrates. The increased insulin level will then help mediate carnitine transport into the muscle, and again will help you eventually saturate your muscle with carnitine. By doing this correctly, by taking carnitine for greater than 3 months, taking it with carbohydrates, you can eventually increase your carnitine concentrations by 10 to 15% through supplementation. Now, what dose do you need to be taking though in order to do that? Well, the scientific studies truly are just unclear on this. If you look at all of the studies, and there's been a decent amount done, they range anywhere from 1 gram to 4 grams per day. But really, if you dig deeper into the studies, you'll see that most effects, or at least some effects, are only seen past 1.5 to 2 grams. So I would say about 2 grams a day for 3 months, taken with carbohydrates, is really going to get you the effects mechanistically that we just talked about of carnitine. However, should you be doing that? And I'm going to blatantly say up front, almost certainly no, except for if you're in a certain populations, and that is because of the serious safety concerns that I mentioned at the onset of this video and that I'm going to touch on right now. Before we get into that, if you guys could please like, comment, subscribe below. That's going to be super helpful for the channel. And also drop a comment as to which supplement or which topic at all that you want me to cover in the next video. Now, the safety concerns for carnitine can really be boiled down to a molecule known as trimethylamine oxide, or TMAO. Now, carnitine is actually converted into TMAO by the gut microbiome in a two-step process, and it's actually been demonstrated in studies that increasing L-carnitine levels increases levels of TMAO within the blood. But why does that matter? What actually is TMAO? Well, TMAO actually increases atherosclerosis, or that plaque buildup within vessels that essentially closes the vessels off and leads to cardiovascular disease, heart disease, and strokes down the road. And it's been actually shown in studies to do this. It's been mechanistically demonstrated in animal studies that TMAO leads to atherosclerosis, and then in clinical human-based studies, they've actually demonstrated that increased TMAO is associated with increased cardiovascular disease and increased risk of all-cause mortality, or all causes of death. Let's look at a few of those studies. The first is Circulating Trimethylamine N-Oxide and the Risk of Cardiovascular Diseases, a systematic review and meta-analysis of 11 prospective cohort studies. What they showed was that high TMAO is associated with a 23% increased risk for cardiovascular events and a 55% increase for all-cause mortality. And then another study, Gut Microbe-Generated Metabolite Trimethylamine N-Oxide as Cardiovascular Risk Biomarker, a systematic review and dose-response meta-analysis, demonstrated that the risk for all-cause mortality actually increased 7.6% for every 10 micromoles of TMAO increase. Now, what these studies actually have not done is that they have not proven causation. Really what they've proven is correlation, meaning they've proven that if you have higher TMAO levels, you are also more likely to have increased cardiovascular disease risk and increased risk of all-cause mortality. However, they have not proven that increased TMAO levels in and of themselves actually cause increased cardiovascular disease risk. It could be a chicken or the egg scenario where actually the cardiovascular disease is actually somehow causing increased TMAO levels. That being said, I do believe, based on the dose-dependent relationship and based on the amount of these studies that have demonstrated this correlation, I do believe it to be a true correlation where TMAO is actually increasing your risk for cardiovascular disease. And I further believe that based on a couple other studies that have demonstrated carnitine directly being related to increased cardiovascular disease risk. One such study is L-carnitine, a friend or foe for cardiovascular disease, a Mendelian randomization study. It demonstrated that those who are genetically disposed to have higher L-carnitine levels in the blood are also predisposed to have higher risk of coronary artery disease, or 7% higher risk. And then another such study, 10-year changes in plasma L-carnitine levels and risk of coronary heart disease. It looked at carnitine levels in healthy women, and then 10 years later, it again looked at those carnitine levels. If the level of carnitine had increased in the blood over that 10-year period, we also had an increased risk for cardiovascular disease. And finally, progression of atherosclerosis with carnitine supplementation, a randomized controlled trial in metabolic syndrome. This demonstrated that with higher levels of carnitine, or with supplementing carnitine, you actually increased the atherosclerotic stenosis of the carotid artery by 9.3%. In other words, by supplementing with carnitine, you closed off the vessel 9.3% more than you would without supplementing with carnitine, which is going to increase, again, your risk for strokes or your risk for heart attacks by increasing atherosclerosis. So, all of that to say, I think there is a great deal of safety concern with taking carnitine chronically, which is what you need to do, again, to even arrive at its proposed mechanistic benefits. However, you're also arriving at this serious safety concern of increasing cardiovascular disease risk, increasing your risk for all-cause mortality, etc. Now, the scientific community has not concluded that this is the case, that L-carnitine supplementation directly leads to cardiovascular disease. If it did, it would not be a legal supplement to take on the market. So, I'm just giving you what the science says so far, and what it says so far to me is pretty convincing that it is not necessarily a safe supplement to take for most people, or at least that it has considerable concerns regarding its safety. However, whenever we talk about these supplements, we always have to talk about the negatives, the safety, the drawbacks, but we can also have to talk about the positive. What are the benefits? Are there some benefits that simply outweigh the risks that we just talked about? Let's get into it. Beneficial effects of L-carnitine supplementation for weight management in overweight and obese adults, an updated 2020 systematic review and dose response meta-analysis of randomized controlled trials. What this study did was it looked at a bunch of different carnitine studies lasting from 2 to 12 months. Most were 2 to 6 months, but again, getting that chronic supplementation. And it looked at how it affects body composition in individuals who are obese or overweight or have a BMI of greater than 25. What they found actually was a significant reduction in BMI, about 0.5 points in BMI, as well as a significant reduction in weight and body fat mass, about 1.1 kilograms over that chronic 2 to 6 month study. However, very importantly, what they demonstrated was that there was no decrease in fat in individuals who had a normal BMI or a BMI of less than 25. The next study to talk about is the bright and dark sides of L-carnitine supplementation, a systematic review. This study more looked at athletes and healthy individuals versus those who are overweight or obese. What they found was, again, similarly to the previous study, there was no change in body composition with those with a BMI of less than 25, and there also was no change in the athletic performance variables, whether that be aerobic or resistance training. Their performance outcomes did not change through carnitine supplementation. Another thing they did demonstrate, though, was a positive effect on muscle soreness and muscle breakdown. As we mentioned previously, carnitine does a good job at regulating protein breakdown versus protein synthesis. It also has anti-inflammatory properties, and this was actually demonstrated on an MRI in this study, which demonstrated decreased muscle breakdown when carnitine was being supplemented. So that was one positive effect in healthy individuals. And next, we need to talk about some clinical benefits based on certain disease processes. First, let's talk about the efficacy and safety of L-carnitine treatment for chronic heart failure, a meta-analysis of randomized controlled trials. The simple hypothesis that this study kind of came to was that part of heart failure could be that the heart just does not have enough energy to contract and pump out blood to the rest of the body. Thus, carnitine supplementation could be improving heart failure by improving fat as a fuel source for heart muscle. And this was actually proven to be the case as far as their outcomes that they were studying found that carnitine supplementation actually improved clinical symptoms. So it improved patients' ability to exert themselves without becoming short of breath. It improved their ejection fraction and their cardiac output, or essentially how well that heart was contracting when carnitine was supplemented. And again, it was hypothesized that this was due to the ability of carnitine to increase fat utilization for fuel. The next study to talk about is another patient disease process, and that is with heart attacks. The study was L-carnitine in the secondary prevention of cardiovascular disease, systematic review, and meta-analysis. Again, this looked at patients after they had an MI or a myocardial infarction or heart attack, and they looked at outcomes when carnitine was supplemented. What they found was that there was a 27% reduction in all-cause mortality, a 65% reduction in ventricular arrhythmias, and a 40% reduction in angina or that chest pain. Again, this is very similar to the mechanism that we just talked about with how carnitine could improve heart failure, and that is that it could possibly be giving that injured heart muscle more ability to gain energy by using fat as a fuel source. And this is very important to talk about because it seems confusing on the surface maybe when we talk about how carnitine could increase your risk for cardiovascular disease, but also it's helping patients after they are diagnosed with heart failure or after they are diagnosed with a heart attack. And it's simply because it's two different mechanisms, right? It increases your risk for cardiovascular disease because it's increasing that atherosclerosis. It's increasing that stenosis or that closure of the blood vessels, which leads to heart attacks and strokes, versus it's helping patients possibly with heart attacks or with heart failure because it's allowing that injured or that already injured heart muscle to produce more energy, more ATP through the utilization of fatty acids as a fuel source. So it can do both, but it's really only helping those patients who are already having injured, damaged hearts, with those with heart failure or with infarcted tissue due to previous heart attacks. And finally, the last possible clinical benefit comes for patients with metabolic syndrome, or those patients with poor insulin sensitivity, with obesity, hypertension, etc. The study was the effect of L-carnitine supplementation on lipid profile and glycemic control in adults with cardiovascular risk factors, another systematic review and meta-analysis. It demonstrated improved lipid profile, so a decrease in the bad cholesterol, that LDL, an increase in the good cholesterol, that HDL. But again, this was really only for patients who had type 2 diabetes or hypertension or obesity at baseline. The studies were not looking at healthy subjects here, and the decrease in cholesterol was somewhat marginal. So, all of that being said, that's really the efficacy, right? We talked about, so all that being said, that's really the efficacy. We already talked about the safety risks and the mechanism. Let me give you the final recs for this supplement based on certain groups of individuals. The first group I want to talk about is if you are metabolically healthy, so you don't have diabetes, hypertension, and you're also not obese or overweight, you have a normal BMI of less than 25. There is absolutely zero reason for you to take carnitine. One, you're not seeing any of the benefits. You're not seeing the decreased fat loss, which only was seen with individuals with BMI greater than 25. Really, the only thing you could possibly see is a marginal improvement in muscle recovery and muscle soreness. However, there is many ways to improve your muscle recovery and soreness that improve it much more than carnitine supplementation would. And you're also not seeing an improvement in your lipid profile or any improvement with your heart function. The only thing that you're more likely going to see is an increase in the TMAO levels, which are going to increase your risk for cardiovascular disease, or are most likely going to, as we discussed previously. So again, if you fall in that healthy, normal BMI group, there is absolutely zero reason to take carnitine supplementation. You can stop the video now. If you are in a second group, if you're metabolically healthy, so you don't have diabetes, you don't have hypertension, but you are overweight or obese, you have a BMI of greater than 25. Should you be taking carnitine for that benefit that we talked about of you're probably going to lose about 1 to 1.1 kilograms extra over 2 to 6 months? Is it worth it? In my opinion, it's definitely not worth it. You can increase your fat loss by increasing the calorie deficit that you're in. 1 kilogram simply is not worth the risk, in my opinion, of increased cardiovascular disease risk, increased risk for all-cause mortality, which has been demonstrated with, again, that increased TMAO that L-carnitine provides. So in my opinion, it's definitely not worth it, even if you're in that group. The final group to talk about, though, is those that are maybe not metabolically healthy. They have diabetes, they have hypertension, they also are overweight or obese, they have BMIs greater than 25, and also maybe they're suffering from heart failure, they've had previous heart attacks. What about in that group? In that group, I would say the jury is still out. And I really would like you to speak to your individual doctor about possibly taking carnitine, as the situations are always very nuanced, and we'd have to see if it actually fits within your medication and supplementation plan. But I think that this group could potentially have benefits. As we've already mentioned, it does seem to improve patient outcomes after heart failure and after a heart attack diagnosis, and also improves lipid profiles for those that are not metabolically healthy. However, again, we still do have to worry somewhat about the furthering of atherosclerotic stenosis of those vessels, which could further cardiovascular disease. So it really is a risk-reward benefit in that situation, and I really do think it's a nuanced conversation that needs to be had with your doctor. Thank you guys so much for watching. Please like, comment, subscribe if you haven't already. Drop a comment with the next video I should make. And with that, I will see you all next session.